So during this conference, there's been a lot of discussion on the disproportionate impact of HIV on women. We're here to introduce the work of an organization that wants to focus on perhaps one of the most ignored and vulnerable populations. In the Leave No One Behind mantra and focus on key affected populations, women who use drugs and the services that are available to them has not had enough attention. Women in Harm Reduction International Network, WHRIN, is about addressing the gender gaps in harm reduction policies and programming around the world. It is bringing together a broad range of people, from women who use drugs, harm reduction advocates and service professionals, and gender specialists together to address these gaps. WHRIN Board Chair Susan Masanja from Tanzania is here to discuss some of the aims and objectives, WHRIN's work, our membership structure, and future directions. Susan is consultant for International Network of People Who Use Drugs, Input, an international network of women who use drugs. She's also been instrumental in coordinating the work of Tanzania Network of People Who Use Drugs, TANPUT, and REACT in Tanzania.
Thank you. Thank you. Yeah, I think it's okay like this. Good afternoon, everyone. My name is Susan Masanja, and I'm a chair of WHRIN, Women in Harm Reduction International Network, addressing the gender gaps in harm reduction. Yeah. Goals and mission. Women in Harm Reduction International WHRIN Network is a global platform to reduce harms for women who use drugs and to develop an enabling environment for the implementation and expansion of harm reduction resources for women. WHRIN's objectives: to provide a forum to discuss the needs and the challenges faced by women who use drugs, to advocate for national, regional, and international bodies to adapt and implement policies and programs which promote and support harm reduction intervention for women and girls. Yeah, thank you. History of WHRIN. The concept for WHRIN began in 2006. In 2008, an initial working group was formed of women working in harm reduction and of people who use drugs from different regions. WHRIN was launched in 2009 at the International Harm Reduction Conference in Bangkok. Close relationship with International Network of Women Who Use Drugs, Inwood. Harm reduction programs need to include nothing about us without us principle. Membership and governance structure. WHRIN began with a listserv and discussion forum. Today there are approximately 400 members. WHRIN membership is open to and includes women who use drugs, harm reductionists, gender specialists, service provider, and anyone who supports the objectives of WHRIN. Membership is made up of both men and women, but only women have voting rights. Dispersed nationally, majority from Australia, United States, Western Europe. Membership also made up of those from Asia Pacific region, Africa, Central Asia, and South America. WHRIN Board. To reflect appropriate representation, the board is women only. At least 2 seats reserved for Inwood representative. The board of directors is composed of chair, vice chair, secretary, fundraisers, and moderator. Input. Okay. Should I start beginning? Okay, at least 2 seats reserved for Inwood representative. Inwood is the international network of women who use drugs. The board of directors is composed of chair, vice chair, secretary, fundraisers, and moderators. Board members will be elected from the membership of WHRIN through a nomination and election process and a simple majority. April 2014 established board. Needs and background. Women established to represent roughly 40% of people who use drugs in USA and Western Europe, 20% in Eastern Europe, Central Asia, and Latin America. Harm reduction service and gender-sensitive intervention have not been adequately integrated into services around the world. Punitive policies are also a major barrier. Issues. Women and men have different experiences of injecting drug use and risks and harms. Gender-based violence, sexual and reproductive health, violence, e.g. prevention, the Tennessee Pregnant Criminalization Bill. Stigma and discrimination, access to health services, policy, and the law. Work principles. Nothing, what's that? Nothing about?
So if we look at the work principles, these are the ideas and concepts that we operate from. So number one, promote drug policies and programs that are evidence-based, respectful of human rights principles, and gender-sensitive.
I got that, thanks. And also, drug use status should never be used as a criteria for loss of custody or access to health and social services. Access to services without fear of arrest, stigma and discrimination of intimidation from men. Relationship and affiliations. Partners with Inwood, international network of women who use drugs. Inwood is global network made up of women who use drugs within international network of people who use drug. Input. Input is an international network of people who use drugs. WHRIN is a global network that aims to accelerate implementation and expansion of harm reduction intervention for women. Nothing is produced when with engagement.
Sorry, that should be without.
Yeah.
Nothing is produced without engagement endorsement. The relationship between Inwood and WHRIN. So we always aim to, if we're writing position papers or policy briefs, to always work very closely with Inwood in developing these as much as possible.
Thank you. Other partners, Harm Reduction International, WHRI, as a part of networks. International Drug Policy Consortium, IDPC, Law Enforcement and HIV Network, LEAN, linking with organizations for issue-specific action, e.g. National Advocates Pregnant Women. Future possibilities. Network development, website, virtual library, focal points, capacity building, assessment response, training exchange, gender audit tool. Database and research. Interactive database with sex disaggregated data, policy briefs, and position paper. programming a global rights violation reporting mechanism. Membership participant. Membership base to catalyze the response by engaging our members to identify and address needs, opportunities, and barriers for action, to be able to call on the expertise of our members from around the world, from gender sensitive to gender specific to gender transformative.
Well, I think what we're aiming for in gender transformative services is for women to be empowered and to have a stake in how programs are developed and how policies are developed. So it's not just women passively receiving the services, but to be able to include their voice and make sure there's forums for that in driving the strategies.
And thank you for listening. And you can join us. Members must agree to objective of WHRIN. First of all,
Yeah, we'll have to change the color. We have some flyers for people who would like to grab the address. Okay, thank you.
so to complete a quick survey and to join WHRIN Listserv, can send a subscription request to wrinlist@yahoo.com. You will be sent an application package with the subscription details. Thank you. You're welcome.
Thank you.
Thank